Hello, my name is Sha-ron Buie, and I'm a paralegal who is employed as the community liaison for the Education Preparedness Program, Kirtle Department at Marquette University. I also work as a case manager and certified peer specialist for the Veterans Transitional Housing Program, Porchlight Incorporated. However, I'm here today in my capacity as a health navigator for the Just Dane organization. I need to talk to you about a very, very serious subject. In fact, you can say it is a matter of life and death. I'm talking about the COVID-19 virus and the vaccinations that have been developed to combat this killer. Now, first and foremost, before I begin in earnest, let me be completely honest with you and tell you that I have taken the vaccine. However, before I took that vaccine, I was skeptical about several factors. After all, there have been times in our history, and I'm talking about my specific history as well as the United States history, when the medical and science community haven't worked so well for people who look like me or from my economic demographic. Let's be straight up. Some medical procedures weren't as safe as they could be or as safe as they were claimed to be. However, I can honestly tell you that after extensive research on my part, and after looking at all types of primary and secondary data on the COVID vaccines, that is not the case with these vaccines. Now, from a practical and common sense perspective, one way that you know for certain if a medicine or vaccine is safe for you and me to take is to see who takes it first. Now, in a lot of cases, the rich, the powerful, the oligarchs will tell you to take it or to do it, but you can guarantee that they won't take it. However, with these vaccines, the richest and most powerful people in the world were first in line to take them. Also, each step in the process to create the vaccines was made known to the public. This transparency in the process of development has never ever existed before in the medical or vaccine development process. And this, more than anything, should give you a little bit of comfort. But even though I am confident in my research and all of the study that I've done, I'll also be honest one more time and tell you that the real reason that I took the vaccine was not for me, but because of a person who means so much more to me than just me. Briefly, my history is this. I served 25 years in the Department of Corrections. I was released from prison on June 30th, 2020, almost exactly 1 year ago today. And no matter what institution I was staffed at, no matter where I was sent, my professor, my friend, my surrogate mother, Sister Mary Painter, visited me every week, either on Wednesday or Saturday, for 25 years. I want you to think about that. For a quarter of a century, this lady visited me every week. Now, this was in the rain, this was in the sleet, the snow, and the shine. No matter what the condition was, whether inclement weather or not, I could always depend on her to be there, either during the summer on Wednesday night at 6 o'clock or during winter at 10 o'clock on Saturday. She was there for me when my only daughter died. She was there for me when I graduated from college. She was there for me through my medical emergencies, like when I had a heart attack. She was there for me for every single important occasion. Most importantly, though, she was there for me through those unimportant occasions as well. On May 23rd, 2021, just about a month ago, Sister Mary Painter turned 90 years old. I mean, just think about that, almost 100 years old. She lives in a place called the Cincinnati House down by Platteville with other ladies who are all in their 70s, 80s, and 90s. As a result of this, no one unvaccinated can visit any of the residents that reside in that house for fear that a single infection could kill every one of those magnificent women. This means that the only way that I could see Sister Mary Painter was that I had to be vaccinated. Well, for me, my choice was very simple. I could either not take the vaccine and not see the woman who supported me, who helped me, who loved me more than almost any other person on this earth, or I could take the vaccine and hug the woman who I love more than just about anyone in this world. For me, that choice was easy. I had to take the vaccine. I had to see Sister Mary. I had to hug her. I took the vaccine, I visited Sister Mary, and I have been thrilled ever since. So, what about you? Do you have a Sister Mary? Is there someone you love more than yourself? If so, consider taking the vaccine for them, if not for you. You'll find that you will feel better and more secure knowing that you won't hurt or potentially kill the ones that you love. I'm talking about your children. I'm talking about your mother. I'm talking about your wife. I'm talking about your husband. Take the vaccine for them, if not for you. Now, I know there are a few issues and a lot of miscommunication regarding the COVID-19 and the vaccinations. So I'd like to tell you what I learned and what I know to absolutely be true. First, COVID-19 is real. It is not a hoax. Actually, the coronavirus was discovered back in the 1980s. If you look on a Lysol can, you will see that it clearly states that it kills the coronavirus. So what we're dealing with is a mutation, or what scientists call an iteration of the virus that affects us in a much, much more serious way. What COVID-19 is a contagious respiratory illness which is caused by the coronavirus. It affects the heart, the lungs, the pancreas, the liver, or other organs in the body. It causes different reactions from different people. So depending on the state of your organs, it can make you sick, and as we know, it can even kill you. Now, COVID is different though from the common cold or flu. That's one of the major misconceptions about this virus. People think that because it affects the lungs, it's the same thing as the flu. Wrong. It operates in a completely different sphere. It spreads much, much more easily than the flu, and it causes much, much more serious illness. Also, it generally takes much longer to recuperate from a COVID-19 infection than from the flu. In fact, many people, including my very own mother, who caught COVID-19, still experience horrific symptoms that last for many months. Frankly, there is no end in sight for the issues that these long haulers face. Now, here's one of the things that I considered most important as I was doing my research. That is the way COVID-19 is spread. Now, it happens to be spread when an infected person breathes out droplets or very small particles of saliva or mucus that contain the virus. In fact, as I'm speaking to you right now, I am exhaling droplets of saliva. You can't even see these droplets, but if I were infected, you can guarantee you would feel them. Think of the times like when you've watched someone speak and they accidentally spit on you. Well, that's how easy it is to spread COVID-19. These droplets and particles, they get breathed out and they may land on your eyes, they may land on your nose or your mouth or your hands. In some cases, many infected individuals contaminate the surfaces that they touch. Think of it like this. I'm speaking directly into this camera on this laptop. As I speak, I am spraying on these keys. So if someone was to come behind me and I were infected and they were to just put in a search query on Google, they could very easily touch a contaminated surface and cause them to catch COVID-19. So the bottom line is that if you're closer than 6 feet from an infected person, you are most likely to get infected. Think about that. So let's summarize it like this, okay? Let's make it as simple as we possibly can. COVID-19 is spread in three main primary ways. One, breathing in air when close to an infected person who is exhaling small droplets and particles that contain the virus. And two, having these small droplets and particles that contain the virus land on your eyes, on your nose, or your mouth, especially through splashes and sprays like a cough or a sneeze. Or three, touching your eyes, your nose, your mouth, just touching your organs with hands that have the virus on them. Think how easy it is to spread this killer. That's why we must become vaccinated. Now, there are a couple ways that we can slow this spread. We can't prevent this spread, but we can slow this spread. And one is to wear a mask that covers your nose and your mouth. I know that is uncomfortable. For me, I suffer from emphysemic bronchitis, so it's very difficult for me to breathe with a mask. That's why I had to get this vaccination. You can also stay 6 feet apart from people who don't live with you, who you don't know, or you can avoid crowds and poorly ventilated outdoor spaces. As long as you're staying away from those individuals, the chances of you catching COVID-19 is greatly diminished. Wash your hands. Just wash your hands with soap and water. And if you don't have soap and water available to you, then use hand sanitizer. These are things that can slow and in some cases even stop the spread of COVID-19. Now, if you're older like me, or if you have underlying medical conditions like me, for instance, if you've had an organ transplant, if you had reduced kidney functions, diabetes, liver disease, high blood pressure, asthma, emphysemic bronchitis, CPOD, heart disease, cancer, even people with disabilities, and these include cognitive disabilities, post-traumatic stress disorder, major depression recurrent type, and then individuals who have their brains that have been affected by specific diseases. I mean, don't forget that your brain is the second largest organ in the body next to your skin. You individuals, us individuals, me and you, we are at higher risk of catching COVID-19. So if you are HIV positive, if you suffer from obesity, if you have sickle cell anemia, if you have substance use disorder, if you're smoking, all of us, all of us, all of us who have these foibles are subject to a higher risk of contracting COVID-19. But most importantly, we have a risk of infecting others, and that is inexcusable. Do you want to be responsible for infecting your child, your mother, your wife, your husband, your loved one? Get vaccinated. Please get vaccinated. So we know that us older people, we're also at greater risk of being seriously ill, and we are at greater risk of dying. But COVID-19 causes death in children as well. Please let me say this again. COVID-19 causes death in children as well. And this is the thing that most people just don't know. This virus is a killer of children. And what is most shocking and disturbing is that many parents infect their own children by their unwillingness to take the vaccine and save their lives. So I want you to think about this. Are you willing to risk the lives of your children because you won't take a vaccine that could help protect them? Do you love your children as much as I love Sister Mary? If you do, then please, please take the vaccine. Now, because of many factors, lack of employment, lack of education, carceral involvement, ignorance, indeed, for many reasons, people of color, people just like me, many marginalized individuals are more likely to have chronic health conditions and less access to quality health care, which also means a much, much higher risk of serious illness and death due to COVID-19. But think of it like this. You now know better. You have no excuse. Also, if you take the vaccine, even if you should by some miracle contract COVID-19, your symptoms will be almost nothing. You now have the information to make a good decision. You can't hide behind, I didn't know. Make the right decision for you and your family. Take the vaccine. So how do I know if I'm sick with COVID, right? What are some of the common symptoms if you should happen to catch COVID? One, a fever. This is why the medical staff constantly are checking for the fever. A cough. When you have a dry cough that appears out of nowhere, you need to go get checked. Headache, fatigues, muscle or body aches, particularly in people my age. This could be weird because I always have muscle and body aches. But if you have these things associated with a loss of taste or smell, or sore throat, nausea, and diarrhea, diarrhea is a big symptom, then you need to go get checked. You need to stay focused. You need to make sure that you are not suffering from COVID-19. Now, some of the signs of a serious infection of COVID-19 and one in which you should go to the emergency room immediately are if you have trouble breathing, if you have chest pain or chest pressure, if you have difficulty staying awake, that's a big one. And it's a big one that most people just don't know about. But if you have problems staying awake, or if your nails become pale or gray or blue colored skin, lips, or nail beds, then you need to go to the emergency room. Because even though as men, sometimes we think that we'll recover, this thing can kill you just like that. Now, before I go, and yes, let me just say this, I'm almost finished, okay? I want to talk to you about some of the rumors that are running rampant on YouTube, in the bars, amongst those who refuse to do the research for themselves, and those who remain mired in ignorance, and they want to take you with them. You know that person. They're like, man, I ain't taking the vaccine. It can make your hair fall out. Those individuals. The COVID-19 vaccine will not make you sterile, nor will it prevent your ability to perform in the bedroom. Let me say that again. The COVID-19 vaccine will not make you sterile, nor will affect your ability to perform where it matters most. Trust me, after serving 25 years in prison, heck, after over 25 years in prison, I know why an individual might be concerned about something like this. There is no way that I would even consider taking anything that can cause that. And I think that says just about everything that needs to be said about that particular rumor. The COVID-19 vaccine was not manufactured or made from the COVID-19 virus. Unlike the flu, you will not be injecting the COVID-19 virus in your body to combat the virus. The COVID-19 vaccine is not a strain of COVID-19. This is why the vaccine is good at preventing the symptoms of all the different iterations and mutations of COVID-19. It targets all the strains of the virus simultaneously. This is huge. Whereas when you take a flu shot, that flu shot only affects a specific strain of the flu. And this means you can catch a different strain of the flu even after you have taken the shot. COVID-19 vaccinations are entirely different. It affects all of the mutations of the COVID-19 virus. So this is why it is critical that you take that vaccine. The COVID-19 vaccine will not cause magnetization or whatever silliness they are now claiming on YouTube. I mean, if you go on YouTube, you'll find something every single day with some expert or some doctor saying that you'll turn into a magnet or that you'll grow an arm out of your forehead. The vaccine, it won't interfere with your 5G or cause you to sprout limbs. The bottom line is this. I believe wholeheartedly from my heart and my soul that after doing extensive research, after reading the primary data, after shepherdizing the secondary data, the bottom line is that the vaccine is safe and will save your life and the lives of those you love if you have the will to get out of that ignorance and go save lives. Now, I'm going to leave you with this. I understand if you're worried about taking the vaccine. Lord knows I was, right? But I overcame that fear after doing the research and seeing the knowledge about the vaccine. Now I feel better than I have in years. And I also want to confess something else to you. As a former United States Marine, I had to go through a gauntlet of shots, and I have a fear of needles. I really, truly do. I hate the fact of getting shots, but this COVID vaccination, it did not even hurt. I can absolutely tell you that. I took the Johnson & Johnson. It was one shot. I didn't even feel it. So now I know that I can go around all those who I love, and I am not concerned at all. Can you say the same thing? If you can't, then please take the vaccine. Your life and the lives of those you love may depend on it. Again, my name is Sha-ron Buie, and I am here as the health navigator for the Just Dane organization. I pray that you have the strength to take the vaccine and save lives. God bless you, and thank you for listening. Have a great day. Goodbye.